kidneys located, one in the right, one in the left. First thing you need to know is you need to locate what is anterior and what is posterior, right? So anteriorly is actually will be the pubis symphysis, which is the bone. Posteriorly will be everything here on the other side. So, knowing that already, you know that this portion from here to here, what do we call this artery? Abdominal aorta. In the abdominal aorta, you have three things that are coming off. The first one is actually four things. So 1, 2, 3, and 4. The one on the top, we call it what? Celiac trunk. This one is superior mesenteric artery, followed by the right and left gonadal artery, followed by the inferior mesenteric artery. Then this artery divides into two, which is what? Common iliac arteries. The blue is the inferior vena cava. Okay? Now the yellow structures here are known as the ureters. So you have two kidneys, two suprarenal glands, and two ureters. Please note that label 24 and this this portion right here, this color, green color, and that one is all part of the ureter. Okay? The actual renal pelvis enabled for me to ask you that it have to be pointing towards label 13. Okay? So anything around this area right here, that will be the ureter. And you can get the chairs and get together. Okay. So from here, the ureters are going to pretty much enter at the posterior and or dorsal end of this structure right here. What's the name of this structure? The urinary bladder. So on the urinary bladder, on the posterior side, you're gonna have these structures right here, which are 49, label 49. They are the vas deferens or ductus deferens. Okay? Why vas or ductus? They belong to what? Male or female? Male. Why male? Because you have this gland right here, which is known as the prostate. Remember, always the prostate is underneath the urinary bladder. So surrounding it, on top of the actual prostate, what do you have? So the seminal gland. Sorry, not seminiferous. Seminal gland. So the seminal gland, and remember, the gland is actually going to secrete what? Mucus, right? And that's going to be part of the semen. Okay. Now, looking at the inside of the urinary bladder, the actual muscle wall, label 47 and 48. So the actual muscle wall, what do we call that? What type of muscle would that be? The trusor muscle. It is a smooth muscle, but the actual name for it is the trusor, right? The trusor muscle. Now, each of these, just folds, they're known as the same thing as the one in the stomach, right? Remember? Rugae. So the triangle, which is the white portion here, we call what? Trigone, right? So the urinary trigone. The trigone actually has two openings, and that's label 40. The two openings are ureteral openings, right? So they're the openings for the ureters, and that's where they actually open up into, okay, on the inside. Remember, the urinary bladder can hold to 1 liter of urine, right? So this portion right here, what do we call it? What urethra? Prostatic urethra. So that portion in the middle, we call that prostatic urethra. Okay? Please know that. Same thing for here, right? So nothing different. Now, on the kidney, supplying the kidney, which I kind of skipped it, that's going to be the renal artery, renal vein, renal artery, renal vein, right? You need to know whether it's right ureter or left ureter. Right kidney or left kidney. That's part of the test. Okay? I know it's kind of like some sort of can be, you can be like, oh, that's kind of dumb. Well, it's not dumb. Because you need to identify, you have to be anatomically correct. Okay? Again, the reason why I do that, you really need to know. The left on the right. It's not the first case that people do the wrong organ. Because they don't know the difference between right and left. And who reports it? Well, the nurses report it. The doctor reads the nurse, instead of examining their patients, since they don't have time, they take the wrong organ. So don't ever go by whatever somebody else says. Always double check.
You said bladder is posterior? Urinary bladder?
The urinary bladder?
Posterior?
No, it's behind the pubis symphysis. Posteriorly to the bladder is the entry of the ureters. Posteriorly to the urinary bladder, surrounding it, you have the three structures. Actually two. The vas deferens and seminal vesicle.
So the right kidney is actually the right.
Well, in your position is always the opposite to your hand. So you can flip your hands if you like. Okay? So remember, if you're looking at it straight forward, and if you're standing here, always do the opposite. Or just shift your hands, right? You do this or you do that. Right? Or whatever. So right will be left and left will be right. Okay? Or you can just do that. Okay. So from there, we're going to go, I'm going to zoom in inside the renal, inside the kidney. So the kidney is going to compose of actually layers from the outside to the innermost. The outside covering, which is that one on top, what do we call it? Renal?
Capsule.
Renal capsule. So please do understand that you have to write renal capsule. Okay? So we have a renal capsule, and then underneath the renal capsule, what do we have? A renal. So from here to here will be the renal cortex. Now from here to here, what do we call it? The renal medulla. So the same thing will be here. If I put any labels around here, it will be the renal cortex. I mean, span is actually the span of the arrow. So it's pointing to the top, I'm pointing all the way to here, and ask you what is the layer? That is the renal cortex. From here to here, and I ask what is the layer? That is the renal medulla. Okay. If I ask you what is the structure in here, then it can be many things. Correct? We're not gonna go there now. So renal cortex, renal medulla. What do we have actually on the cortex? Well, on the cortex, you can have small ones like this one, which is 17. And 17 is what? The renal corpuscle. Okay? It's just the little ball. Right? The whole thing is the renal corpuscle. And what is the renal corpuscle? It's actually this label 39, 32, and whatever label is for this one. So that the whole thing is the renal corpuscle. Can you guys give me that one right there? the microscopic, that one. So bring me that over. So I can just go over everything. So you can go. Okay. So the renal corpuscle, which is pretty much the same one that I was trying to that I showed you guys a couple of times. So you have the renal capsule, the actual capsule, glomerular capsule, sorry, the glomerulus. You have afferent and efferent. So this glomerulus and glomerular capsule, what do we call those? The whole thing? The whole thing will be called what? Renal corpuscle. The same thing as 17 in this one, right? If I just point to the inside, well, you know that is what? The glomerulus. Okay. So, following things that actually you can find here. So since we are at the level of the glomerulus, I guess it's fair enough for us to go all the way explaining this one. So, after the glomerulus, a glomerular capsule, what do we have here? So that will be proximal convoluted tubule. And this one on top will be distal convoluted tubule. Tricky questions will be this too. Okay? The tricky question will be, on label 38, what type of cells are found within 38? Juxta JG cells, right? So, JG cells. So the JG cells are actually juxta glomerular cells. So, these juxtaglomerular cells, what they do is they activate what hormone? Or actually what sets of hormones? Renin, angiotensin, aldosterone. That will be a really hard question. You probably gonna have it. Okay, so renin, angiotensin, aldosterone for the cells in here. Now the other one that can be asked is this one. So 36 is actually the lumen, and it's the whole thing will be the distal convoluted tubule. So surrounding the distal convoluted tubule, you have cells, which is labeled 37. So what is the hormone related to this cell? What are the hormone? What is the hormone related to this cell? ADH. So the hormone related. So what hormone will be stimulated through these cells? And that is going to be ADH. What is the name of the cell? Macula densa. So it could be this one way. The cells in here, JG cells, right? Juxta glomerular cells. Please no, don't put JG.
But that's the
Juxtamedullary.
Alright, where? Where are they doing
On the afferent. On the model is on the afferent artery. Now the macula densa are actually 37, and the hormone that is activated is going to be ADH. Okay, so you need to know those things. Got it? So in here, which is pretty much going back to this, I'm missing that one.
Sorry.
So going over this one, again, this is the what? Glomerulus. That one is what? The Bowman's capsule. And this is a what? proximal convoluted tubule. Okay? One is descending, one is ascending. I'm not going to ask you that. If I point to something like this, it's going to be just plain proximal convoluted tubule. I'm not going to drill into it. I don't see the point of it. It's kind of weird, like the way it is. So, what is the collecting duct? It will be the yellow one. Okay? What is the distal convoluted tubule? The one on the top. Okay. And that's pretty much what you need to know. Again, the same things can apply. What are the name of these cells right here? Juxtaglomerular cells. What are the name of these cells right here? Macula densa cells. What is the hormone that they stimulate? ADH. What is the hormones or cascade of events that they stimulate? Aldosterone. It's fair enough, guys.
But that's not different.
Huh?
It's not different.
That's A friends. Yeah, and this is E. Remember, one is thicker than the other one, guys. It's just that this is supposed to be adipose, but whatever. For teaching purposes, that's what you need to know. Okay? I know it doesn't look like cells, it looks like adipose tissue. Okay? So that's done with that one.
Afferent is the one that's like that has the facts.
Amber, you're using weird words for me.
Afferent?
Oh, I thought you said amber. I was like, color whites, I'm done. Okay, so
I said afferent.
afferent or afferent is actually the thicker one. Efferent is actually the thin of the two. Now, going to this one, okay, what are we looking at? We're looking at the actual nephron. So if you're looking at the nephron, you're still going to divide it the same way. So let me put this one on the side so you can see it. So we divide it on the top. What do we call the top? Cortex. What do we call the middle? Medulla. So what do we call the top? Cortex. What do we call the middle? Medulla. So on the cortex, what are we going to have? The same structures that we have there, the same ones here. So what are they? The green one, each one of the green ones, what do we call it? The whole thing. The glomerular corpuscle. Okay? Now, if it's only the outside, so only the outside, what is only the outside? If I say only the outside, Bowman capsule. Okay? So far so good? Now, which one will be afferent, which one will be efferent in this one? And it's kind of tricky, but it's really simple. So the first thing you have to do is which one comes in and which one leaves. Okay, so that will be, and if you look at it, one is thicker than the other one. Which one is thicker of the two? This one, right? So that is afferent and this is efferent. Okay, the other way of looking at it or finding it out how you do it, and it's really straightforward. So let me do the vasculature so you can actually see it. So let's go to the actual flow of blood all the way through the cortex or medulla. We start with this one, which is the same thing as this one right here, right? This one right here. So what do we call that one? The renal artery. The renal artery gets a portion, and then that portion we call it what? Segmental. And then the segmental, it becomes what? Segmental becomes interlobal, and interlobals may become what? At the level of the arch. Arcuate artery. And these arcuate arteries, they move to make straight cortical lines. What do we call those? Cortical radiations. Okay, so cortical radiating arteries, but cortical radiations is fine. Okay? Now, remember, there are two labels that you're going to probably experience, which is one that expands from all sides. That could be either cortex or cortical radiations. If they ask you for what is the structure, what do you answer? The artery, right? The cortical radiating artery. If they ask you for the segment or the whole portion, what do you answer? Cortex. You got that? So that's the way that it tends to be confusing. Okay. Now, for the part of the for this part right here, okay, we have this side right here, which is pretty much this one's. What is the name of this artery right here? Artery. Artery. What is number 8? Label 8 here. Interlobal artery. So, guess what this one is? The blue, by the way. Arcuate vein. So make sure you know the difference between a vein and an artery. So you have to stay that within the sheet of paper. So the arcuate artery, you're gonna give radiations, right? What are the name of these things? Same thing as this one. So these are known as cortical radiations. Cortical radiations are gonna give another branch, which are known as what? The one that you already know. One or the other one, right? Or one or the other one. So it could be afferent or efferent arterioles. So far so good. Remember, always the afferent are thicker, right? the efferents are actually thinner. So far, so good? Great. So, following that, what are the last arteries that you need to know? And these are going to be the ones that are around the tubules. What do we call those? Peritubular, and they're not arteries, they're actually what? Tiny, tiny blood vessels? Capillaries, right? They're capillary beds. And the ones surrounding the loop of Henle and the collecting duct, vasa recta. And just you understand, some of you are recording me. The vasa recta are the ones that are straight, right? The peritubular are the ones that are straight, the ones that are horizontal. So that's the truthness. But for teaching, for asking the questions on the exam, they're really small. So you're gonna see some sort of label. I'm gonna ask you, what are the name of these ones? Vasa recta. What are the name of this one? Peritubular capillaries. Again, because they're around the tubules. So what are the name of the tubules? Well, we started with the Bowman's capsule, correct? And now, from the Bowman's capsule, something is living. So what is living here from the Bowman's capsule? Anybody? What is this one? Proximal convoluted tubule, right? Proximal convoluted tubule. Proximal convoluted tubule. So the proximal convoluted tubule is going to be actually what? Beige color or brownish? What color is that? What color is that one?
Beige.
Beige? Okay, great. So we agree on something. Okay, so beige color. So proximal convoluted tubule, and then after proximal it becomes what? No. After proximal, what do you have? The descending portion of the loop of Henle. You have the loop, and then you have the ascending. And if you look at it, there are different labels, so be expecting to have different labels on it. I don't know what I'm going to ask until I see the models. But, the more I can ask you is the 3 labels. Okay? There's nothing else. You cannot invent anything else. So, this portion, which is number label 9, is supposed to be what? Descending. This portion right here is just plain loop, or if they put 9 and 10, what is it? Loop of Henle. Just don't put loop. If you're going to put something, put nephron loop, right? But just don't put loop by itself because I'm marking wrong. I'm saying since today.
So it's descending what?
The 9 is supposed to be descending loop, descending limb of the loop of Henle.
Limb.
Just descending limb. Limb. L-I-M-B. So descending limb, ascending limb. If it's 9 and 10, is the loop of Henle. Okay? So after the loop of Henle, what do you have? Distal convoluted tubules, which is distal convoluted tubule, distal convoluted tubules. Right? And then from the distal convoluted tubule, you have what? A main collecting duct, right? Which is going to be shared for multiple nephrons. Okay? So far, so good? Okay, great. And we're missing small things. So small detail is pretty much after the collecting duct, what do we get here? Actual, the urine, right? It's going to be here. So at this level, what are you going to see in this model? So that level, it will be this right here, right? So at this level, what are you going to have? Well, this portion right here. And that portion is known as the renal papilla. Now, this empty pocket right here, not this, that's the renal papilla. This empty space, what do we call it? Minor calyx. A minor calyx, you can see it is here, 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 and there. Minor, because it's only one. Now, what is a major? When you have 1 and 2, what will be this portion right here? Major. 1 and 2, what will be this portion right here? Major. Now, please note it, what is the difference between this one and number 13? 13 is the actual renal pelvis. It's all the major papillas all together. Okay? So 13 is the renal pelvis. Now, do you remember what was the renal hilum was? They tend to have, it's the 3D, right? So it completes pretty much everything. It means you have the ureter, the part of the renal, the ureter, the renal artery, and the renal vein, right? So that will be the hilum. But they have to tell you the whole 3D structure, or they tell you table 13, 14, and 15. What is that whole thing? Okay, you guys got that?
You said it's major papilla.
Renal.
Renal papilla, minor calyx, which is the same thing as this one.
What did you used to do?
Minor and then major.
How do you know?
So you're
Why are you
just
taking
gonna-
this class?
You're gonna
Not
use
already.
that one for that. You're not gonna use the big one?
What big one?
The other big one.
If you find a model, I'm gonna go ahead and fill in there.
What did you do?